Hello, good day everyone. I am Dr. Pia Reseno. I am an adult hematologist here in Asian Hospital and Medical Center. Today I will be answering some questions on the importance of blood for our patients. Alright, question number 1. What is your point of view as a hematologist on the importance of blood to your patients? Of course, as a doctor, as a blood doctor, blood is very important. And like what I always tell my patients, there is no alternative to blood. Even with the advancement and all the technology that we have now, none has been discovered yet to replace what blood components can do to our bodies. So it is very important. It is life-saving. It is something that a lot of patients need in the management of their cases. Even if you have all the money in the world, if no one will donate for you, we need someone. Blood transfusion is a branch of medicine wherein you really need someone to help you, someone to donate for you, especially in emergency situations. What are the struggles that you had encountered during the pandemic, specifically for those patients who need blood transfusion? Ever since the pandemic started, we really have shortage of blood supply due to several factors. Of course, the donors are scared to go to the hospitals or they're afraid to go out. We have limited blood donation activities. Our hospitals, our blood banks, even Red Cross, we do mass blood donations, but now that there are restrictions to these gatherings, to these activities, then we have limited blood supply. Now that the ECQ has been lifted and we are under GCQ, we are trying again to organize these activities, but of course, we still have a restriction in terms of the number of donors we can cater to. Because of the limited blood supply, we expect that there's a delay in the management of our patients who need blood transfusion. Napakahirap po para sa ating mga pasyente, especially for those patients who are actively bleeding. They would need emergency transfusions. What are the blood cells that they need? What are the blood components that they need? They need red cells, platelets, and a lot of times, nagkukumahog po ang mga relatives and, ang mga doktor in finding blood. We need donors. Donors are needed to really transfuse blood. Wala pong pamalit sa dugo. Third question, how do you manage to provide their needs during the lockdown? Is there any backup plan? For now, really, since we are limited and we are restricted by certain regulations, then we really cannot do anything but to outsource from Red Cross and really appeal to the relatives and friends of our patients. We call all the branches of Red Cross, we call Blood Center, and even other hospitals. We try to network, in asking for blood. So we try to help each other, the hospitals, the institutions, and the organizations in procuring blood for our patients. What are your most requested blood components? What are the blood components and their use? So the most requested blood component will be your red cell. When you say blood component, ibig sabihin po nito, ano pong specific na cell, yung pong isinasalin sa ating pasyente. The usual or regular donation, you usually donate what we call whole blood. And right now po, ang recommendation po natin, practice component therapy. Ibig sabihin po nun, hindi na po tayo nagsasalin ng isang buong dugo. Pagka po ang blood ay in-extract or dinonate nyo po, pinaprocess po ito ng blood bank, we process it to blood components. Meaning, yung pong isang dinugong dinonate ninyo, ito po ay nahihiwalay into a red cell, a platelet, 1 unit of platelet, and also a unit of FFP. Which also means that 1 unit of blood, of whole blood that you donated, can actually help 3 patients, the maximum of 3 patients. So, the first component would be your red cell. This red cell po, yung red cell po, that is the carrier of the oxygen po in our system. So, if you are anemic, Then depending on your clinical presentation, your hemoglobin, then we transfuse red cells. A lot of times, just 1 or 2 units of red cells. If you are actively bleeding, then we transfuse more. Second would be your platelet concentrates or your platelet apheresis. So we have 2 types of platelets. One is the random donor platelet. Ito po yung binanggit ko kanina, the one that you get from whole blood, that is the platelet concentrate. Maliliit po itong platelet na ito. And we transfuse them in bulto-bulto po. About 4 to 6 units or, depending on the weight of the patient. We order platelet concentrate transfusions. If I say that you need transfusion of about 4 to 6 units, then that means 4 hanggang 6 na tao rin po ang kailangang donor nito. So there's another type of platelet. It is I think it's a more recommended type of platelet, the one that we call platelet apheresis. Platelet apheresis is a type of platelet. It's a one big bag of platelet. So what we do is there's a donor and there's a machine. This machine processes all the platelets. It gets the blood from you. It processes the platelets. It gets the platelets, collects the platelets, and the machine then returns the other blood components to your body. So this is a more preferred type of platelet. It is more effective in a way, and also we want this because this would mean that our patient would be exposed to only 1 blood donor. Next is fresh frozen plasma. This is the liquid part of the blood. For patients who are bleeding a lot of times, then this is what we order. For some patients po who cannot tolerate, big volumes of plasma, and meron pong mabababang clotting factors in their system, then there is a type of blood component also, what we call the cryoprecipitates. So itong cryoprecipitate po, nakukuha rin natin ito doon sa plasma. We encourage component therapy, meaning kung ano lang po ang kailangan, what blood component we need. So if you're anemic, then we give your red cells. If you have low platelets, then we give your platelets. Kung kulang po ng blood clotting factors, then we give your clotting factors. We would like to maximize yung use of blood. And also, we want to minimize the side effects of blood transfusion to our patients. Remember that blood transfusion is also a type of treatment. As with any other treatment, it carries risks. Meron pong mga risk, meron pong side effects, meron pong adverse effects. And we want to give transfusions only if needed and if indicated. July 2021 is Blood Donors Month. I encourage you to be a hero, be a blood donor. Kailangan po namin ng tulong ninyo, our patients need you. I hope you can be blood donors and help save our patients. We can organize blood donation drives for you. Please contact our blood bank. Asian Blood Bank is open and is willing to accommodate donors. Just contact 8771-9000, local 5789. Thank you. Please help us. Please save lives.
Good day, everyone. I'm Dr. Edwin Munoz, the blood bank pathologist at the Asian Hospital and Medical Center. Today, I'm going to answer your questions about blood donation. So the first question potential blood donors have in their mind is, what's blood donation? It is a process by which we take out about 400 to 450 ml of blood from the donor through a puncture in his or her vein. So the blood is transferred to a bag that contains anticoagulants to prevent it from clotting. After that, the blood is processed into different components. There is the red cell component, which is used for red blood cell transfusions for anemic patients. There is also the plasma component, which is used for patients who need replacements of coagulation factors. And then there is the platelet components for people who have low levels of platelets and are at risk of bleeding. Of course, in the process, there's going to be a needle that's going to be inserted into the donor's veins. This part we cannot help, because there's no other way of taking blood properly from the donor. There is another type of blood donation we call apheresis. We can collect from one donor what is the equivalent of 6 bags that come from 6 individual donors using the conventional form of blood donation. So this is very useful for patients who need a lot of platelet transfusions because they get exposed only to one donor instead of 6. Now at the Asian hospital, we can do both the conventional type of blood donation and apheresis donation. So how can donors prepare for blood donation? First of all, it is important that the blood donor is feeling fine on the day of donation. They should not feel like they're going to come down with an infection or, let's say, a cough and cold. We would advise the blood donor to take a light snack and about a glass or so of water or fluids before blood donation so that they don't feel faint after the donation. This is to replace the amount of blood that will be taken during the donation process. Before a blood donor donates blood, he or she will have to answer a questionnaire. This is called screening of blood donors. So in the process, we will be able to determine if the blood donor can be qualified for blood donation. So who are good candidates for blood donation? Generally speaking, we're looking at people who are between the ages of 18 to 65 years old and who are generally healthy. Of course, it is important that to start with, they have enough blood for themselves. They should not be anemic. So they should have hemoglobin levels of 125 for women and 135 for men. Now, many potential donors will ask, I just received COVID vaccination. Can I donate blood? A potential blood donor will have to wait 28 days after receiving COVID-19 vaccination before they can donate. This is true for the COVID-19 vaccines that are currently available in the Philippines. Potential donors who have received Pfizer-BioNTech mRNA vaccine and perhaps later on Moderna vaccine can donate at any time as long as they feel well. Potential blood donors who are taking medicines for high blood pressure or medicines for high cholesterol levels can donate as long as their medical condition is under control. Now, potential donors who had previous episodes of hepatitis unfortunately cannot donate blood. Potential blood donors who engage in risky behavior that will predispose them to HIV also cannot donate blood. Generally speaking, donors who recover from infections and common cough and colds may donate after 14 days to a month depending on the infection. Potential donors who have questions can call our blood bank coordinator. What can a donor expect after blood donation? After blood donation, the puncture site will be bandaged and pressure will be applied to stop any possible bleeding. Blood donors might expect some discomfort in the area where the needle was inserted, but this should not be persistent. They may expect some bruising in the coming days. Now, after blood donation, our donors will be given a light snack in order to replenish the fluids that have been removed from them. This will prevent them from feeling lightheaded or dizzy. The donor is advised to refrain from heavy physical activity for the rest of the day. So people who do heavy manual labor, who go to the gym, maybe they can do that the following day. Another question that is commonly asked is, can I donate blood to my relatives? Generally speaking, we discourage blood transfusion between blood relatives. There is this condition called transfusion-associated graft versus host disease. Because the donor and recipient are closely related, they share a lot of similar genetic material. The recipient's immune system may not be able to recognize the donor's lymphocytes as foreign to them and destroy those lymphocytes. So in the process, the donor's lymphocytes may engraft in the recipient and start destroying the recipient's organs. This is what we call graft versus host disease. It's a rare condition, but it is almost always fatal. So we don't encourage transfusion between blood relatives. If it is essential that we transfuse blood between relatives, what we can do is irradiate the blood first. Irradiation will inactivate the lymphocytes in the donor's blood and prevent graft versus host from happening. But this is another extra step in processing the donor's blood for transfusion. At the Asian Hospital, we celebrate Blood Donors Month every July. We thank our blood donors for their unselfish efforts to come in and donate blood. Every blood donation is life-saving. We cannot thank our blood donors enough. We encourage healthy individuals to consider blood donation. During this time of pandemic, our blood supply run really low. Every blood donation counts. Blood donors are really our everyday, modern-day heroes. The theme for this year is Give Blood and Keep the World Beating. Don't hesitate to call our blood bank coordinator to schedule an appointment. At the Asian Hospital, we guarantee you a safe and comfortable environment for blood donation. Come donate blood and be a hero today. Thank you.